We don't have a working long-term care financing system right now. About 12 million Americans today need long-term care. The majority of them are 65 and older. About a fifth of them, slightly more than a fifth of them, are 85 and older. And long-term care needs are going to soar over time as the baby boom generation gets older. So over the next 40 years, the population that's 85 plus is going to more than triple. That's going to lead to a huge increase in long-term care needs. Today, a nursing home costs on average $75,000 a year. It's a lot more in certain parts of the country. Home care is expensive. On average, it costs about $16,000 to $18,000 a year, and that's only if you use about 15 hours of care, receive 15 hours of care a week. And there's just not a good way of paying for it. So long-term care is not covered by traditional health insurance. Medicare covers long-term care only under certain conditions and only for a limited time. There are some special private insurance policies you can buy to cover long-term care, but very few people do. Today, only about 12% of adults 65 and older have private long-term care insurance. The coverage rates increase with education, but even among those with a bachelor's degree, only about a quarter of those 65 and older have coverage. So what happens is that most people pay for long-term care out of pocket until they run out of money, then they go on to Medicaid. And there really isn't a very good long-term care insurance system. It's really not insurance at all. The designers of CLASS wanted to create this government-run government-run long-term care insurance that overcame many of the shortcomings in private long-term care insurance market. So first, they wanted it to be open to almost everyone in the population. Private insurers tend to try to exclude people with health problems because they're more expensive. So they engage in this medical underwriting. They either charge people with health problems higher premiums, or they refuse to cover them at all. CLASS wasn't going to do this. CLASS would have no medical underwriting, and the only way in which they're going to exclude the people with the most serious disabilities was to impose a very modest work requirement. They would require people to work for at least 3 of the first 5 years after they enrolled. So that people with the most serious disabilities then would not be able to meet this requirement. They would be screened out. But the work requirement was very lax. You only had to earn about $1,100 a year. So a lot of people with disabilities would have met this requirement, and so it really didn't screen out too many people. A second goal of the CLASS designers was to make the insurance affordable. One of the reasons that people give for not buying private long-term care insurance is that they simply can't afford it. CLASS wanted to overcome this problem, especially for low-income people. And so what they would do is set the premium at only $5 a month for people whose earnings did not exceed the federal poverty level. So they have all these great inclusive features. They're trying to get as many people onto the program as possible, but at the same time they had to operate within many of the same constraints that private insurers face. In particular, they had to be solvent. They had to raise enough premiums to cover their benefits. And that's going to be tricky when you have some very sick people on the program, and when you have low-income people who don't pay many premiums. And so what that means is that healthy, moderate, and high-income people would have to subsidize these lower-income people, these people with health problems, at the time of enrollment. If you think about who's going to join, you're going to participate in this program if you think that the benefits you receive are going to be about or or more than the premiums you pay. So think about what happens if we have a program in which the premium is set so that it covers the expected benefit that the average person would receive, assuming everyone in the population participated. Now in that case, people with who expect to receive a lot of benefits because they have health problems, it's going to be a good deal for them because they're going to get more benefits than the average person. They're going to get more benefits than the premium they pay. They're going to join. On the other hand, the people who are very healthy, who don't expect to receive many benefits, they're not going to join because they're going to get fewer benefits than average. Their premiums are going to exceed the benefit. So now what happens? The premium was initially set to cover benefits, assuming everyone participated, but the healthy people are out, the sick people are in, the premiums aren't high enough, the program's losing money, we have to raise the premium. Once we raise the premium, though, that pushes even modestly healthy people. Now the program no longer makes sense for them because the premium is higher. They're not getting enough benefits to cover this new higher premium, so now they drop out. This cycle continues, you get this vicious cycle, the market collapses. And this problem is what economists and actuaries call adverse selection. And so as a result, it's not really surprising that the administration decided that the program as written is really unworkable.